All right, so today we're going deep on something pretty crucial, and it's healthcare, and specifically potential changes coming down the line for Medicaid.
Yeah, definitely a big one. Healthcare is always a hot topic,
Yeah.
and
Yeah.
it seems like it's always changing.
Right, well, it impacts so many people. So we're going to dig into some proposed cuts to Medicaid that have been approved by Republicans.
Okay, cuts to Medicaid. So that's the program that provides health coverage to millions of Americans,
Yeah.
particularly those with lower incomes or disabilities.
Exactly. And what we found looking at this video transcript from the Ring of Fire is that these cuts could actually hit red states the hardest. And that's because those states tend to have the highest enrollment in Medicaid.
That's interesting. So the states that often vote Republican might be the most affected by cuts to a program that many of their residents rely on.
Yeah, it seems a bit counterintuitive at first glance, right? So we want to unpack this whole thing and figure out what's really going on here. Like, what's the thinking behind these cuts? And what are the likely consequences, particularly for, our listeners out there?
I think that's a really key point to emphasize the potential impact on individuals and communities, because ultimately policy decisions made at a national level can have very real and tangible effects on people's lives.
Absolutely. So let's get into the details. The transcript mentions that the Republican plan is calling for a whopping $880 billion in cuts. That's a huge amount of money.
Wow, 880 billion. That's a significant reduction. And it definitely raises questions about where those savings will come from and what the implications might be.
Right. And according to the source, the primary target for these cuts is Medicaid. And they specifically frame it as a way to offset the costs of those tax cuts that were passed a while back, the ones that critics say mainly benefited wealthier Americans and corporations.
Okay, so the argument is that these Medicaid reductions are necessary to balance the budget after implementing tax cuts that some argue primarily help the wealthy.
Yeah, that's the gist of it. And it's interesting because this source clearly sees it as a trade-off. They're basically saying that these tax cuts for the wealthy are coming at the expense of healthcare for those who are less well off.
Right, and that perspective definitely aligns with a broader critique of trickle-down economics, the idea that tax cuts for the wealthy will stimulate the economy and benefit everyone. But critics argue that it often leads to greater income inequality and reduced social safety nets.
Exactly. And that's where this whole thing gets really interesting because the data shows that a lot of people in those so-called red states actually depend on Medicaid. I mean, the numbers are pretty striking.
Okay, so let's dive into the data. What kind of figures are we talking about here?
Well, the transcript mentions that in 15 states, at least 1 in 5 working-age adults in small towns and rural areas are covered by Medicaid.
Wow, 1 in 5. That's a significant portion of the population relying on Medicaid for their healthcare needs.
Right. And in some states, it's even higher, like in Arizona and New York, more than a third of that same demographic is covered by Medicaid.
New York. That's interesting because it's not typically considered a red state, but it highlights that Medicaid reliance isn't solely a partisan issue.
Absolutely. It's more nuanced than that. But what really stands out is that many of these states with high Medicaid enrollment are, in fact, those that have historically voted Republican. Like 8 of those 15 states that I mentioned earlier voted for President Trump.
So there's a potential disconnect here, right? You have a political party pushing for cuts to a program that a significant portion of their own voter base relies on.
Exactly. And it goes even deeper than that. The transcript points out that there are 26 Republican members of the U.S. House of Representatives who represent districts where Medicaid covers over 30% of the population.
Okay, so we're not just talking about abstract statistics here. These are real people in specific communities whose lives could be directly affected by these proposed cuts.
Right, and they even give a concrete example. They mention Republican House Speaker Mike Johnson, whose own district in Louisiana has a high rate of Medicaid coverage and a large rural population.
That's a really compelling example because it highlights the potential tension between a politician's policy decisions and the needs of their own constituents.
Now, it's important to clarify that the source doesn't say Republicans are trying to get rid of Medicaid entirely. It's more like they're trying to make it less effective by cutting a lot of the funding from the federal government.
Okay, so it's more about making the program inefficient rather than completely eliminating it.
Yeah, and to understand how that would work, we need to remember that Medicaid is funded through a partnership between the federal government and the states.
Right, it's a shared responsibility. The federal government matches a portion of the state's spending on Medicaid.
Exactly. And the amount that the federal government contributes varies from state to state. Sometimes it's a 60-40 split. Other times it's 50-50 or even 70-30 where the feds kick in a bigger chunk.
And as you mentioned earlier, those red states with high Medicaid enrollment often receive a larger share of federal funding.
Right, and that's where the potential problem lies. If the federal government slashes its contributions, many of these states, especially those with already tight budgets, may not be able to make up the difference.
That makes sense. Those states might not have the resources to suddenly cover a much larger portion of the costs.
Exactly, and that leads us to the really concerning part. The transcript quotes the source as saying that less access to healthcare inevitably means more deaths, especially in rural areas and among the poor.
That's a sobering thought, connecting reduced healthcare access directly to increased mortality rates.
And they even bring up the Affordable Care Act, pointing out that when Medicaid was expanded under the ACA, life expectancy actually went up in those areas where more people got coverage.
So the implication is that reversing that expansion and cutting back on Medicaid could lead to a reversal of those positive health outcomes.
Exactly, and it's not just about individuals either. The transcript also talks about how rural hospitals are already struggling with almost 200 of them closing or cutting back services in the past 2 decades.
Right? Those rural hospitals are often a lifeline for those communities, and they rely heavily on Medicaid funding to stay afloat.
So if Medicaid gets cut even more, it could be devastating for rural healthcare, leading to even more hospital closures and people having to travel further for care.
It creates a kind of domino effect where cuts at the federal level ripple down and have a very real impact on access to healthcare in local communities.
It's interesting, though, the transcript mentions that cuts to Medicare, which is the program for seniors, seem to be off the table for now.
So it seems like Medicaid is bearing the brunt of these proposed cuts.
Yeah, that's the impression I got. And they also briefly mention the idea of requiring people on Medicaid to work, but the source dismisses that as unlikely to save much money.
Right, work requirements have been a controversial topic, with critics arguing that they create administrative burdens and often don't result in significant cost savings.
So to sum up, the source's argument is that these Medicaid cuts are mainly driven by a desire to offset those tax cuts for the wealthy. And the people who will end up paying the price are those who can least afford it. You know, low-income folks and a lot of people in those red states that rely heavily on the program.
It highlights the potential disconnect between policy goals and the real-world consequences and raises questions about who benefits and who bears the burden of these decisions.
Exactly. And the source even suggests that many voters in those red states might not fully understand how much these cuts could impact their own health care.
Which raises a really important point about transparency and informed decision-making.
Right, so let's recap. We've got $880 billion in cuts to Medicaid being proposed, and data shows that the states with the highest Medicaid enrollment are often the same ones that vote Republican.
And those cuts could lead to fewer people having access to health care, more strain on rural hospitals, and potentially even an increase in preventable deaths.
And it all ties back to this idea that the cuts are being made to pay for those tax cuts that largely benefited the wealthy.
It's a complex issue with potential consequences for millions of Americans, and it underscores the importance of understanding how policy decisions can have a very direct impact on people's lives.
So here's a question for you, the listener. What do you think the long-term consequences of these cuts will be? Will they actually save money? Will they lead to better health care? Or will they end up hurting the very people they're supposed to help?
And how will these cuts affect the political landscape, especially in those red states with high Medicaid reliance? Will voters hold their elected officials accountable, or will they support these changes despite the potential negative impact on their communities?
It's definitely something to think about, and we encourage you to do your own research and stay informed on this crucial issue.
Because ultimately it's about the health and well-being of millions of Americans, and we all have a stake in ensuring that everyone has access to quality, affordable health care.
Thanks for joining us for this deep dive, and we'll catch you next time.
See